The future of healthcare is digital, and India is at the forefront of this transformation. At the CII Tamil Nadu Medclave, with the Federal as the digital media partner, a diverse panel of experts gathered to discuss EMR to AI, building the truly digital hospital. From clinicians to tech innovators, they shared how technology is redefining patient care while keeping people at the heart of the system. A truly digital hospital is not about replacing humans with robots. It's about empowering patients, clinicians, and staff with data driven tools. Dr. Ilankumaran Kalayamurthy, Chair at CII Tamil Nadu Medclave and Chief Executive Officer of Apollo Hospitals Chennai region, explains what it means to build a truly digital hospital.
Truly digital hospital means keeping the people at the center. People can be patients or people can be an employee. Keep the people on the center, connect them digitally, or take all the decisions data driven. That's what truly digital hospital means.
Several hospitals have introduced technology in their daily operations to ensure a complete digital transformation in providing patient care and services.
Today there are over 1.2 million people who work in an industry that did not exist 15 years ago. So I think the opportunities that we're seeing in India in the last few years is a lot more money is there. We want to see more innovators who want to take a risk. I think that is the piece that is missing, and we need more people like the folks at PwC and many of the organizations, EY, KPMG, you name it, McKinsey as well, BCG, that need to start helping these Indian innovations and companies go global, right? Because I think the rest of the world doesn't have an answer. India will find a better answer, right? This is the only part in the world where healthcare is a tenth the cost of what it is to go bankrupt.
CA Ashokan, CIO Apollo Hospitals, says that from seamless appointment bookings to AI-enhanced diagnostics, technology is making healthcare more accessible and efficient.
The focus areas that I would kind of look at for this enterprise today is, one, how do I bring in augmented intelligence, enabling access and reach, enabling documentation for clinicians, improving their productivity, and also help us to see how do we connect the unsaid dots between information and access. The second priority that we work on is try and then look at how do I run operations with evidence-based care, with evidence-based operations as well in terms of data. Third is about how do I build scalable, secure infrastructure that lays as foundation for this entire operations.
For large healthcare systems, digital tools streamline patient journeys and empower clinicians. But what about the challenges of security and stakeholder alignment in such a complex system?
I think most of us, or I would say 100% of the healthcare leaders and the industry, they strive hard to maintain the trust, because trust is something which builds the hospitals. The best marketing, I would say, still today is, instead of so much of digital marketing and this digital marketing era, the best thing is still, I would say, a word of mouth. So when we say a word of mouth in marketing, that's nothing but the trust which the patient has on your brand.
While large hospitals lead the way, cloud technology is a game changer for scaling digital solutions across India. However, security and data sovereignty remain critical concerns.
How do you bring your EMS data? How do you bring your billing data? How do you bring your imaging data? How do you bring all of this together? Of course, with the permission of the consent of the patient, or whatever the guiding principles that you will have from the governing that you would have from the regulatory. Bring them together, create the data lakes, and be able to literally, actually productively run AI on top of it.
Building a truly digital hospital in India is not about EMRs or AI only. It's about orchestrating data, infrastructure, people, and policy.
Guidelines prepared, guided by Telemedicine Society of India, were issued by the Ministry of Health and Family Welfare. So that has really opened the gates for people, the doctors, the medical hospitals, educational institutions, and the patients together to adopt and accept the telemedicine as a legal, viable, and available process or a procedure for the teleconsultations.
To fully harness AI, India needs standardized high quality data. From EMRs to agentic AI, the focus is on creating India specific solutions that address local healthcare needs.
India's standing is defined by rapid clinical adoption and a brave move towards the building, a strategic move towards building a unique national foundation, which is implying that it's a very high potential, at the same time, uneven maturity.
Moreover, startups play a vital role in this journey, but they face unique challenges in developing relevant solutions for hospitals. Collaboration with healthcare stakeholders is key to success.
So I would say that we are in a good place right now. But however, I do feel that there are a lot of technologies which are being innovated, which are being developed without the, taking the inputs of the healthcare system. You need to talk to the doctors, you need to talk to the hospital administrators, you need to talk to the nurses, you need to talk to the entire ecosystem before you can figure out what exactly they need.
India's healthcare system is on the cusp of a digital revolution. By combining AI, cloud technology, and stakeholder collaboration, hospitals are building a future where care is seamless, secure, and centered on patients.